Okay, so now we're going to go over the process of administering meds via the gastrostomy tube or G-tube. Again, before starting, we want to know that we have the tube measures correct external length, or it meets the marker that's indicated in the patient's chart. We can check the gastric pH again. And again, since we're in the area, we're going to look at the site around, make sure it's healthy. So before starting, it's important to mention that as often as you can, and you can discuss this with the pharmacist in your area, you want to have a liquid form of medications if and when available, again, because that will help prevent clogging of the tube. Some situations you can't actually get a liquid form of a medication, in which case you would be crushing a pill form using either Silent Night or mortar and pestle, depending on what the facility has. You want to crush it really, really finely, and obviously you want to make sure that it is a medication that can be crushed. It's safe to crush. The other general principles is we're going to flush before we start administering meds. So this is kind of just how I'm going to show we're going to flush before with 15 to 30 mLs of water. We're going to give a med, then we're going to flush again with 15 to 30 mLs of water, give a med, and flush again, and so on and so forth. So this kind of shows that process. And if we do have to, we had to crush this one pill, so we're going to mix it with about 15 mLs of tap water also, if applicable, to help kind of mix it, or help kind of mix it there with the syringe. We're going to need a syringe to deliver the medications to the tube. We're going to need gloves. So, and of course, we're going to go through all of our medication rights. We're going on preparing, and then when we get to the bedside. But just for time's sake, we're going to just show the administering of the medications into the tube. And you would want to make sure that you're calculating throughout the total volume that you end up putting into the tube, because again, you're going to want to indicate that on that in and out record, so that we have an accurate fluid volume tracking for this patient. So we've verified the correct placement of the tube using the pH, and we're going to go ahead and start with our first flush. I should also mention that it's important if the person was running intermittent tube feeds, or continuous tube feeds for that matter, that if you do need to give medications, you're going to interrupt the tube feeds, and then you're going to flush and give the meds and then flush before restarting. Some meds specifically have contraindications with the tube feeds, with the formulations, I guess, of the tube feeds. So you would want to discuss that with your pharmacist ahead of time, and or dietitian, or both, and you want to know that oops, I spilled some there. You wouldn't want to do that because you want to have a correct and accurate dose. So you just want to make sure you're talking to your dietitian and pharmacist throughout, making sure they're aware. So we're just instilling the medications. You can tell that I'm sort of kinking off the tube in between so that nothing comes back out. We did an initial flush, we did a medication, then we do a flush. So generally we do give the medication separately. You may see it done different in practice, but best practice is to give the medication separately. There are some instances, again, where you'd want to discuss with the pharmacist if certain medications can be delivered at the same time, say because the person is on a lot of medications and it's not necessarily appropriate to be separating them and giving that much volume, but that would be a pretty special instance. So that's sort of the pattern you follow: flush, medication, flush, so on. For your pills, you might want to mix them well up ahead of time, because you see I'm kind of having them, they're still sort of floating in there, so you kind of want them to dissolve a little bit and mix up quite well, because if you can see, this is the kind of remnants, if in a tube, will actually clog it. So it's actually a good example, but we would let this sit, or we'd mix it a little bit better with a straw or something clean to help mix it before administering it. because you can even tell if it's not well mixed, you're going to miss some of the medication because it's kind of going to collect on your syringe. So mix it well ahead of time, or even mix it in the med room, draw it up in the syringe, and sort of do an in and out with it. Try not to lose medication while doing that. And again, you're going to want to flush well after, especially those crushed tablets. So that's pretty much it for med admin.